Heroin is an incredibly potent chemical, one of the most potent chemicals known to man. One of the greatest obstacles in people that are addicted to heroin to actually get sober and is the true detoxification from it. Most people are so terrified of the withdrawals from heroin, and they've experienced it when they've run out of their drug for a period of hours to a period of even a day or two, or even longer, is that dope sickness. And that fear of going through that significant and substantial withdrawal is what drives people to continue use. They just don't want to experience it, and they feel it's such an incredibly strong physiologic and physical and psychological constellation of symptoms that it prevents most people from ever actually seeking help and ever initiating any attempt at recovery. You can't attempt recovery while still using, so it's just an impossibility. Addicts that are out there trying to do this on their own will try a variety of different methods, and it's never routinely effective because it's not monitored by professionals. What our protocol is for heroin detoxification is to initiate a detoxification with medication-assisted treatment. So what that means is we actually use an opiate to taper people off of opiates. Depending upon the length and intensity of use, we'll typically use a medication called buprenorphine, which has a ceiling effect, meaning it hits the receptors a little bit differently than heroin does, but it does satisfy the receptors to decrease or attenuate, reduce the level of craving and the level of sensation of withdrawal. We don't use too much buprenorphine because using too much buprenorphine has its own problems, and there really is no buprenorphine for buprenorphine. So we don't want to get somebody totally physically dependent upon buprenorphine as a result of tapering them off of heroin. Weaning them off heroin, pardon me. In order to do that and to use a reduced amount of buprenorphine, we add several other medications on top of that to help attenuate those other symptoms. The restless legs, the anxiety, the headache, the nausea, the vomiting, the diarrhea. There's a variety of different medications that are used. They're all prescription medications that are also used to help reduce those symptoms. Reducing the symptoms down from, let's say, a 10 severity, the worst that somebody could imagine, down to a 2 or 3 is kind of our goal. It's not to eliminate it entirely, because eliminating it entirely actually runs the risk of gaining dependence upon that medication as well. So it's to reduce it while, so to speak, landing the plane, getting the patient from a place where they were actively using the drug to now they're using a controlled medication that's being administered and prescribed by a physician and administered, and taking them down to a safe level, a slow taper, typically 5 to 7 days, depending upon their length and severity of use, sometimes longer if they're still having continued symptoms. We monitor the patient's vital signs, we monitor their activity level, we monitor their verbalized symptoms to see where they are with regards to their detoxification process, and we make adjustments as need be. There's no cookie cutter standardization to all this because everybody feels differently than other people feel. They have different pain tolerances, different pain thresholds. So it's not, giving a cookie cutter is not the right answer. But using a constellation of medications, we are able to reduce symptoms and make the detoxification process relatively comfortable. Relatively comfortable, meaning it's you wouldn't feel any worse than you would having a minor cold.